I also have to change my arrangement. I will take 2 or 3 minutes.
Okay.
Thank you. I'll be back shortly.
Okey
No
doke.
problem.
Right, this says it's now recording. Oh, and let me just let someone else in as well. So hopefully, yeah.
Oh, brilliant. Morning, Alison.
Morning, everyone.
Morning.
Hi, Catherine.
Yeah. I've just started recording the meeting. I hope that's okay, because a lot of people they couldn't make, because of the time zones and everything, couldn't make this time. So I said I'd record it for them. So hopefully that's okay with everybody.
Yeah. Has everyone had a chance to read the paper? Does anyone need a few minutes at the beginning just to read through maybe the abstract opposed to the whole paper? Morning, Bonnie. I'm going to take the silence that everyone has.
else.
Do you want me to start, Kath?
Yeah, I think so. I have got, it's typical. I've got a dreadful internet connection today. So if I just like go blank, that's that's why. But yeah, I'm happy for us to start. And yeah, please feel free to use the chat as well as we go along. And yeah, thank
Brilliant.
you for everybody.
Yeah, welcome everybody. So this is kind of like how I feel about the Journal Club, is I want to learn as much from everybody here as anybody else. So I have gone through the paper in detail, and I know Kath has, because we had a little chat together at the end of last week just to kind of check we're on the same page. But there are a few areas where we're not experts in qualitative research, and there are a couple of kind of ways that the researchers have approached things in this paper that we're questioning, but we would love to hear other people's views on it, just to see if you were kind of thinking on the same lines of us, if you've read it in other articles that have approached it in a similar way, or if actually we're questioning what they've done. So does everyone have the CASP form, or has had a little look at it, or can get it up? Because we can pop it in the chat if anyone doesn't. So I really, oh, super. I really like this as a format to go through Journal Club, because it gives us great questions to look at, and it's got discussion points for us as well. So I'm going to go through each section. Oh, Ronnie's just joining as well. Brilliant. And then if anyone's got anything to chip in or any questions, then feel free just to chip in. You don't need to, you can raise your hand because I should be able to see it, but you don't need to. Just like unmute yourself and chip in, and I'll ask a few questions along the way as well. Morning, Ronnie. That will be great. So the first question is then, was there a clear statement of the aims of the research? Now, actually, from those that have read the abstract, you might feel the same, is that it's not really very clear at all in the abstract, because in the abstract, they just say it's something along the lines of they want to, it's the wording explore, it's something really generic. Yeah, we aimed to explore the nature of maternal health literacy among ethnic minority women, which I thought, what is that? What is this exploring? What are you actually trying to do? And if that's all you're saying that you're doing, how can you have a clear finding from that, from this exploration? But further in the text, in the main article, they say that they're going to examine the nature of maternal health literacy by exploring which formal and informal sources of health information ethnic minority women access and trust, and how women draw on these resources and their social and family networks to apply their understanding to health information and make decisions. So I thought that was absolutely fine for the statement. If everyone was kind of happy with that, any questions?
Yeah, I thought just I'm going to jump in. I thought it was interesting
Please,
that
Alison.
they seem to focus so much on just the social side of things, but that didn't really come across in the objective. They were like, oh, we're going to look at everything to do with health literacy, but actually they didn't. And
No, yes, I totally agree with that as well. Yeah, just the social side of things.
Yeah.
Okay, is a qualitative methodology appropriate? Now, this again, Alison, you might have had similar feelings to this. I was thinking, if it's just on its own, I felt like the quantitative data would have really added something to say, well, what is their health literacy currently? What are we looking at? Where are their strengths? Where are their kind of weaknesses or opportunities to develop? That having it alongside a quantitative element would have strengthened it. That was my take on it. That I thought qualitative was appropriate, but I felt it would have been better if it had been supplemented with some quantitative research or a quantitative element. Go on, Alison, tell me what you were thinking. It's on the tip of your tongue.
It is, but this is my first time here, so I don't want
it's our first time. We're all new in this together, so carry on.
No, I guess so. For me, I am a qualitative researcher,
okay.
So it worked really well as qualitative, and I guess the one thing that, because it was focusing so much on the social, so I was wondering if that we really could measure health literacy, because there's not many health literacy tests that measure the social, so whether the qualitative made sense there, but that's my thoughts.
Yeah, no, absolutely. And that's what that was kind of on my thoughts. Well, would be which method or do they want to look at which element of health literacy would they want to look at? Yeah, exactly. If they were going to measure it. Cool. I'd said yes as well. Does anyone else have any thoughts on that? Everyone's happy. Okay. Well, actually, do you know what, Alison? We've got some questions around some of the qualitative research design, so you could have some answers for us. So this is good. So is it worth continuing? Yes, we want to know more about this paper. Was the research design appropriate to address the aims of the research? So I've said yes. They said that they've taken a pragmatist approach, which I've just put a note there, that no single point of view can ever give the entire picture and that there may be multiple realities. So that sounds absolutely true to this research. And they've taken, it's a particular ethnographic design, is that right? Which is around trying to understand how people live their lives, which really ties into that idea of distributed health literacy and those people that they are using to support their health literacy and the information that they're getting from others around them. Ronnie, do you have any thoughts on that?
I have very little useful thoughts. My brain is just mush. I have to admit that despite setting a calendar reminder a week ago, I read the paper shortly before this meeting. I have just been writing my thesis non-stop.
No problem at all.
Yeah, but I mean, it's, in terms of the design, I think for this sort of thing, they're looking at lived experience of people and how they construct and figure things out in correlation to other people, which is ethnographic qualitative research. So it seems to make sense from that point of view.
Okay, thank you, Ronnie. Yeah, Natasha.
Yeah. Actually, I'm very sorry, accept my apology, because I also do same like Ronnie. I had gone through the paper very quickly days ago, and today before the meeting I was trying to recall everything, and still now I am having it's opened on my screen. So first of all, I think usually what we do, there are 17 or 18 definitions of health literacy. So every country or every researcher, sometimes they have their priority to follow which definition they will work with. So here I from the questionnaire, I couldn't find actually what was the health literacy.
What definition they were using? No, they didn't put it in there.
Yeah. So
that's a really good point.
And if we want to have the health literacy definition at least followed by WHO, or maybe by the Christian, maybe by Christian Sorensen or Donna, then whoever it be, it could be standardized or made it easy for us to make up its standard or available everywhere. That's the question, my first point. And secondly, qualitative data is very good. For of course, it's very good, but sometimes when we have to collect the data from any diseases, suppose in COVID-19, there we go for the, whoa, look who's here.
She's just off to school.
Oh,
They say
hello.
They said hello. Do you want to hear?
What's her name?
This is Betsy. She's
Betsy?
literally should be out the door going to school. Go on.
I am.
Hi,
Have a great day.
Betsy.
Give them a wave. Say bye-bye.
Bye-bye. Have a good day in school.
She's just basically wiped her nose on my dress. No, I know.
So sweet, so cutie.
Okay, bye.
I miss my daughter's this age. She's 13 now and she's fully grown up. And every time she puts her opinion over me. So I miss those days.
She's cute this age.
Anyway, and we go for the quantitative because sometimes, like the epidemic situation in COVID, we have done the quantitative thing. But of course, qualitative research, we need to understand the health literacy situation in the countries very well. And we know Vietnam, as far as I have gone through several literature or articles and newspapers, Vietnam is very good in health literacy. And recently, when we were following them for the COVID situation, they have managed it very well. So it is understandable that yes, Vietnam is very good in health literacy, and they usually follow their doctors or their government's health rules very properly. So it's another information I should add to our group, not regarding only for this article. So this article is a good one. So as far as Samantha will go with the points of discussion, then I think I will be able to add more or have some points to discuss.
Yeah,
For now,
absolutely.
it's
Thank
okay.
you.
Okay.
Thank you, Natasha. No, that's really useful. So then we're on point 4, which is, was the recruitment strategy appropriate to the aims of the research? I thought it was good that they'd use the assistance of the Vietnamese Women's Union. I thought that seemed like a good element to the recruitment strategy to be able to recruit women. And then I just put the only thing that we don't know is how many were asked who didn't want to take part. We don't know how far that went, how far the reach went, and people were turning it down. I don't know if anyone else has got anything to add to that. Yeah, there's Bonnie.
I'll jump in, sorry.
Yeah,
I just wish they'd made it a little more clear of how sort of supplementary the Vietnamese Women's Health Service was in the recruitment, and whether they caught people who might be disengaged in those kind of services. Because I'm sure they did, but they just haven't articulated it very well. So I would have liked to have seen a bit more of that.
Yes, I agree with you. And how were they trying to reach those harder to reach ones? What techniques were they using and how did they do that? Yeah, I totally agree with you. So point 5.
I'd also
yes, Ronnie.
They say that they purposefully sampled the diversity. So that suggests there must be people that were presumably willing to be interviewed, but that they didn't select, and we don't know anything about those, how that decision was made. So, which is fine because, qualitative, you can't interview everyone. You do need to purposefully sample, and cover a spectrum, but it would be nice to know how many they approached and how they made that sort of decision. Yeah,
I agree.
Or at least if they had some exclusion criteria. Inclusion and exclusion criteria. I'm sorry, I lost the connection for a while because we had a power cut. I'm not sure if you mentioned in point 1 if they could have mentioned the research question or something rather than saying exploring. That's where I lost the connection. So I just wanted to mention that point.
Let me note that down. Let's see. No, that's a really good point, Carmel. Actually putting it as a research question. State the aim as a research question. Lovely. Okay. Brilliant. Thank you, everybody. So question 5. Was the data collected in a way that addressed the research issue? Now, I couldn't come to a definitive conclusion on this. I put a question mark because the bit that I was, or kind of my sticking point of what I was thinking was around holding focus groups where multiple languages are spoken and how difficult that might be with using an interpreter, the kind of lost in translation from either side, either from the participant or from the translator. People may be trying to move faster because it would be moving at quite a slow pace. If the researcher is speaking, then it's being translated to the participant, and the participant speaking back to the translator, back to the researcher. I could imagine that people are maybe thinking, oh, come on, let's just wrap this up a bit. I can imagine it being quite difficult. I don't know if anyone's got any experience of that themselves, where there's been multiple languages spoken, there's had to be interpreters used in their research like that, or if there's techniques that can be used to help facilitate that in the most appropriate way.
I've done
Yeah, it's a very good point. Sorry, Alison.
No, you go ahead, Natasha, that's fine.
Okay, thank you. Actually, yes, because translating verbally sometimes differs with the questionnaire, actually what they want, what we want to know, and what the participants answered. So here it would be very good if we could make a translated questionnaire documented. That would be the best, documented. And what we do actually, when we send some data collector, we give them training. But here they say that only a nurse was interviewing them, only, and we don't know whether he or she had any background of data collection. What does it mean, DTL? I don't know, nursing background with DTL, maybe it's diploma or her degree. But professional training, or may not be professional, but a training for taking interview is very vital, because sometimes what happens when you go for the qualitative research or qualitative interview, actually the participants tries to understand your tone of question. They would like to answer what you want to listen. Like they don't go for the hospital every time they feel sick. But when you say, do you go for hospital whenever you feel sick? In this tone, they think that, yes, I should say yes.
Yeah.
And that's the weak point for CAP study, knowledge, attitude, and practice study. What we get always that they have less knowledge, but high attitude in scoring. So, and in practice, they are, again, they get a low score. So it would be better if we had a documented, translated version of the questionnaire. And if it's translated, it's okay verbally, but it would be better. And a trained one is also a preferable one. Thank you. Alison, you wanted to say something?
No, I was just going to follow up that responding to Samantha's question about research. So I have done bilingual research before, but only in contexts where everyone was bilingual. So there was a lot of in and out, but everyone understood. So it did strike me as quite challenging to have 3 different languages and mutually exclusive, sort of being able to understand all of those. So I thought that was challenging. I was glad that they separated the mothers and the grandmothers in the different focus groups, because I thought that could have been slightly not coercive, but it could have influenced the questions.
Yeah, definitely.
And also I was going backwards and forwards. They said that they held them at the community health leader's house, I think. And obviously that probably would help to include trust, but I wasn't sure if that might also direct people's answers to what they thought the community leader might want to hear. I don't know. But that's a tricky one. But,
yeah, I would agree. That's one thing that occurred to me, Alison, is that we don't have enough information to know about the context, but certainly in some of the answers that are given in the results section, you see the influence of community leaders and older people. So I can see some situations where that might perhaps inhibit people being able to.
That's a really good point, Ronnie. Yeah.
The other thing I would say is, if you have got focus groups, I think the idea of them is that you have more free-flowing discussion. So like a question will go out and then people will talk about their experiences, which will spark somebody else to talk about their experience, and it can go off and it sort of starts to bring all that sort of thing out. And I question how well that can work with a translator, because having been in situations where, you know, I've had somebody sort of interpreting for me on occasion, you're basically sitting there waiting, and then they give you the short version to get the point across to you, and then you give your answer back, and everybody else is waiting. And multiple people like that, I don't think that maybe in that context focus groups were necessarily the best. They may have had better results doing like a one-to-one interview where they could have really drawn those things out in the actual single language.
Yeah, I really agree, Ronnie. That idea of sparking is like one of the real core values of having a focus group, of hearing other people and it kind of triggering your memory and thinking, oh, actually, I've got something to add to that. And that is, I can imagine that would really be lost in that situation. Yeah, thank you. I don't know, what do people think then? So was data collected in a way that addressed the research issue? I don't know. I suppose the answer is yes, but I don't know. I couldn't decide. I wasn't committed to give an answer. I don't know if anyone else feels strongly if they could say yes or no.
I just thought they didn't justify it either way, because much like what Alison and Ronnie were saying, I would have liked to have seen some sort of justification for why a focus group in that context with all those challenges was better than just a one-on-one interview.
Yes.
It also stressed that they didn't mention confidentiality until the results section, which was a bit of a red flag to me. So I'm in a similar boat to you. I'm like, I don't know.
Yeah, I just put a question mark.
Sorry, was there
I think what happened here, because they have gone through a third party organization, that's the point or of explanation why they couldn't go for individual interview or have chosen the focus group discussion, because the third party wanted this thing that would be feasible for them. Because what happens in our country like Bangladesh, Vietnam, India, there are some organizations who help a woman in different kinds, some financial helps or some health literacy type or health lecture type things. So they arrange the women's group in one house, or what we can say in their yard, and they took the researcher took the easy way, or the what should I say, the benefit of having all the participants in one group in a short time. So that's the point why they use the focus group discussion, and there is no actual explanation for that. And also maybe the third party, the organization, wanted the researchers to do as a way, because I myself have the experience when we wanted to do one research in the garment sector, ready-made garments factory. You know, ready-made garments factory is the biggest earning sector for Bangladesh. So when we wanted to interview the garments worker one at a time, interview 1-to-1, but the authority didn't allow us. They said, no, you have to go for 30 in half an hour. Okay. So we used to go one time and focus group discussion type of thing and focus group interview. So maybe it could be the explanation for this research also. I think I'm not clear.
Yeah. Okay. Thank you, Natasha. Carmel, were you going to add a point there?
Yes, I wanted just to ask if there was just one interviewer and one translator, or was it more than that? Because it also makes a difference in terms of reliability of whatever data you're collecting, whether it's the same person or they've been trained to ask and respond in the same way or not.
I don't think it said, did it? I don't think that was clear.
Have to
yes, Samantha, I thought
multiple
that
because
they said yes.
Vietnamese,
one.
Thai, and Hmong.
One.
Sorry, Bonnie,
but they don't.
Yeah.
Sorry, because there was Vietnamese, Thai, and Hmong. I kind of assumed there'd be three, but they haven't specified.
Yeah. Sorry, and Natasha, can you repeat your point?
I thought I read somewhere that there was only one interviewer and one translator, if I'm not wrong. And as Kamel was asking.
Yeah, and that's what I'm not sure if it's one that did all three languages or one for each language. I think I had read it as one, but I'm not sure if it was one for each of the languages. I'm not sure.
Okay.
So if it's just one, then we have high reliability. But if it's three
Yeah.
individuals, it
Mhm.
introduces differences.
It does. That's a really good point. Oh, one of the other things that I've noted down, and I would really love to hear other people's opinions about this as well. So in the back of the paper, they've put their focus group discussion guide. They've put the questions down and the prompts. And one of the prompts they've used, I'm really interested in people from your own experiences of qualitative research about using the word why. So I was watching some online training a few weeks back, and they were talking about why you shouldn't use the word why in qualitative research, that it can make people feel quite defensive, and that when you're asking why, it's kind of saying, well, you need to justify yourself, that I need to hear the reason behind this, like that doesn't sound okay. And I was talking to another researcher about it, and they were like, oh, I use it all the time. And I was like, oh, okay, this is interesting. So they've included it in there. And then I've just sort of said, maybe it would make people feel defensive if you're asking them why, but I would love to hear other people's opinions on that with their qualitative research.
Yeah, I don't have any strong opinions. I would tend probably to say, can you tell me more about X, or
Yes,
share a bit, so to make it, as you say, a bit less
softer.
defensive.
Yeah, I've written that, tell me more, as an alternative. And I was wondering that about are there other ways that, or other phrases instead of saying why? Tell me more.
Going back to what Natasha mentioned,
in your opinion,
it depends on the tone.
Sorry,
Yeah, I completely agree with you that we shouldn't use the word, but in a more polite and softer way. But I was thinking whether they have any other way of talking in their local dialect or in local. Maybe that is the reason they use that. And usually we just ask, can you tell me, would you please like to tell, do you have any problem to uh, explain it more? Would you like to explain it more? But maybe in their context, why is not that much a negative word, or they don't mind at all. Maybe it's a
that's a
kind
really
of
good
thing.
point. Yeah, thank you both. Kevin, have we got a point?
We can say some statements that what we understood from their statement. We can frame a statement, and whether we can ask them to explain that whether what we have interpreted is right or wrong. If it is wrong or right, in other way, you can explain more about this. You can go ahead with the building of this.
Yeah, definitely. Okay, brilliant. I've made a point, actually, this is where Alison and Natasha talking about the kind of the domains of health literacy and what element they were trying to explore in this research. And I made a note about the domains of health literacy. Did they want to know more about the accessing the information, the understanding it, or assessing it? Is this considered in the discussion guide? I just kind of put a question because it wasn't, I don't think, it's not clear. They haven't put their definition of health literacy, and they haven't said if there's one particular area of it that they're trying to focus on. Okay, so question 6. Has the relationship between researcher and participants been adequately considered? I put no. I've said they haven't discussed their reflexivity, so their reflections on it, their understanding, and I put they haven't set their kind of their position in it. So I was wondering if they were a parent themselves. I don't think any of those things are clear in there.
Sorry, I have a point to make regarding the previous point. Because I noticed in the abstract that they mentioned that family members are important sources of information and that they influence decision making. So these are the two aspects I think they were focusing on.
Okay, yes. So they're accessing the information that they've got it,
and
decision making. Yeah. Thank you, Carmel. Decision making, yeah.
I did think it was an interesting point as well about what you were saying about the positionality of the researchers. I get, maybe it's more at the forefront of my mind because that's something I'm kind of considering with my own research at the moment. But yeah, you don't really know much about them, like whether they've experienced the health system themselves, the maternity system themselves. So yeah, an interesting point.
Yeah, and I thought as well, just building on that, like she's obviously a doctoral student, the researcher, but that's also like a lot of pressure on her. I wondered like what the supervision, I could have mentioned something about her supervision arrangements as well.
Yeah, that's a great point. Yeah.
Well, also the team largely seems to be from Sydney. So why and how is the research being done in Vietnam? What's the link? What's the focus of their research? I thought that,
yes. Because it's an interesting point, isn't it? But it is not discussed in the paper at all. Yeah, that's a really good point.
Yeah, that's a very good point, Ronnie. I didn't look at that. Yes, it's a very interesting point. Why from the person from Australia? Maybe she is from Vietnam.
Yeah.
Is there any writing or any explanation about it? That where is the researcher actually from? Maybe.
No,
it's possible the second author. Probably from the name of the authors, you feel that the second author is probably from Vietnam.
Very good, very interesting point, Ronnie.
Yeah. Yeah, that is a really great point. Have ethical issues been taken into consideration? I've put that ethical approval was given, but I said that it would have been kind of interesting if they'd made a point about, because it's quite a sensitive topic, if someone had become distressed, what they would do, if they were able to signpost to another organization, or what they would do, and also kind of how that works with the translator as well. If something was said to the translator, what would they do? What would those steps be to kind of safeguard the participants? That was my note on the ethical issues side, but it'd be great to hear other people's thoughts.
Yeah, it seemed quite a token, like, yeah, we've done the ethics, just trust us, but there was no real exploration. And some of that might be due to the word count, but it would have been nice to think a bit about, there were a lot of different cross-cultural connotations as well as other ethical aspects that would have been good to think about. I agree.
Brilliant, thank you. Okay, question 8. Was the data analysis significantly rigorous? And this, Alison, this could be the question for you and others with qualitative experience. So they talk about the thematic analysis and they talk about it being inductive and deductive. And can you do both approaches? Is that okay? Because so one is drawn from the data, kind of the smaller pieces of data looking for bigger themes. This is my understanding. And the deductive is like the bigger themes and ideas drawing down into the smaller, like your raw data, I suppose. And Kath and I were having a discussion about, is it okay to take both? Can you take both? And we weren't sure.
Yeah, I can jump in with my thoughts.
Yeah, please do.
So from my perspective, it did trip me up a bit as well, like the iterative and the deductive. I sort of had to read that sentence a couple of times because I could understand the deductive, because it felt like they really just took, I think it was the Edwards model with 4 sections and just applied it. So I didn't really see any evidence of the iterative, the data driven. I just didn't, because I just thought that if they would have done that, there might have been some quotes or like, oh, this didn't fit within the Edwards framework, or, so it surprised me to see that they said that they had done iterative. I can see that it can work together, but yeah, in this case I just didn't see much evidence of both. I just saw
totally agree that it did sound like they've applied the Edwards framework and said, yes, our data fits very well within that. But that's a great example of how they could have shown that some of it hadn't. That's a great idea, that those quotes going in saying actually this doesn't quite align with it.
Yeah.
This is what else we saw. Yeah, thank you, Alison.
Yeah.
I've just done, it's been the bane of my life, but I've just done some thematic analysis, and I started off with an idea of what the codes would be, because my interviews were structured very much around the HRQ. So I expected to see codes that would align with the scales, and there were, but there were also a lot of others that didn't. So I would say, I know I used both in that I expected to see these, and actually some of them didn't end up being included. I got rid of them, but I also had others that emerged, not emerged, people don't like the word emerging, but others that I found within there that came from the data. It wasn't in anything that I had pre-planned. So I think that's how you can
use both. I see,
together.
yes.
It's just leaving that space for things to come up that you think are quite strongly a theme, but they weren't ones that you necessarily expected to see in the beginning.
Yeah. That's great. Thank you, Ronnie.
Yeah, and it said we completed coding, and I wasn't sure who we was, and so that would have been nice to be clear, like did they all code independently then come together?
Yes, there was no
also,
detail in that, was there?
Yeah, that's it. And also, what sort of coding approach did they use? Was it like process coding or open coding or in vivo coding? You know, there's so many coding styles you could have used, so that would have been good to know.
Yeah. Dolce, I can see you've unmuted, if I've pronounced your name right. No, maybe not. Okay. Does anyone else have anything to say around that, the data analysis side of things?
I just want to ask the people who've worked before with this kind of analysis. I understand that in some cases you find the themes and the codes based on the literature. So you go through the literature and then you go to the data and you try to identify whether you see those kinds of themes. And in the other way would be the inductive, where you go through the data and then without the literature and try to identify your codes. Is this correct, or how is it supposed to be?
Yeah, that's exactly how it. So I mostly use iterative, the inductive. So I would look at my data first and then build up my themes and codes from that data. But other people would come in with like an idea of like either a framework or a theory or a model and try and impose that and have a look and see how well it fits. Absolutely.
Okay, thank you.
Okay, question 9. Is there a clear statement of the findings? I think this ties into what we were just saying about they've used the guide from Edwards 15 to say that their findings sit along or kind of blend with that well, and they talk about this idea of distributed health literacy. That's kind of as far as I got with that, really. I don't know so the clear statement of findings, I think, just as Alison was saying earlier, that they didn't pull out the bits that didn't fit with it. So I suppose there is a clear statement of findings, but if it's actually sharing all of what they found, it's probably they've missed some elements, maybe, but maybe they haven't. Maybe they found it did all fit in perfectly and that is how it was. I assume it didn't, but I guess we don't know.
I don't think I totally agree with Samantha. I find it very clumsy. It's not very clear or very definitive that we find from the research we found this, and this should be the what we should do, or maybe in the discussion part they have explained. But actually, I didn't find the result presentation very good. I think it's very elaborative and it's very spread out, and we have to wrap up there to find the results, a clear-cut result, and have to go through all the sentences written, all the subsections. Everything is very spread out. It's not very concrete, I think. What others think.
That's how I felt as well, Natasha. There was one other thing, actually, I've just remembered looking back through the paper that I thought I wish was recorded in the participant characteristics, because they spoke earlier about they had a range of mothers who had given birth, I think, in the hospital facilities and those at home. And that was one of the points that we were talking about inclusion and exclusion criteria, weren't we? That was one of the things it wasn't an inclusion or an exclusion criteria, but they'd said that they'd try to get a spread. And I was thinking, oh, actually, that would have been really nice in the participant characteristics then, so that we know what that spread is. But they didn't say the numbers, and it's just reminded me that I saw the table that it wasn't in there. And that was another thing that I thought, oh, I wish I'd been able to see that and exactly see what that spread is.
Two things that occurred to me when I read this paper. The first question was when they were talking about, you know, they say that, you know, it demonstrates that distributed maternal health literacy is evident. Some of the things they were talking about, my question was, is this actually distributed health literacy, or is this simply a result of a lack of health literate practice? So when you are being forced to rely on family members to interpret things, yes, they're helping you understand, but I'm not sure that's distributed health literacy in the sense that you are using other people to help you augment your knowledge and make decisions. It's more that's literally the only way you can get access to that information.
Not an alternative.
Which led me to then wonder whether it's also very common in sort of in this culture and other cultures that decisions are made collectively or by community leaders or by family members, etc., which is very different than, say, in like where I am. That wouldn't be normal for me, which made me then wonder whether the concept of distributed health literacy is actually different, is actually culturally specific, and we should bear that in mind when we're thinking about the research that's talking about distributed health literacy. I don't know what other people think, but
that's a great point, Ronnie. Yeah, really interesting. And also because they haven't given this definition of health literacy or distributed health literacy, it's hard to say what their position of it is or their understanding. I think that's a really great point, Ronnie. How did you find that, Ronnie? What were your thoughts about, is there a clear statement of findings?
Not really. I mean, I think there's also, you know, I would have liked to have seen a little bit more information on, so that they've illustrated their points, they've picked out their points, and they've included certain quotes. And obviously when you publish, you've got word limits and all the rest of it, which make it really difficult. But we don't have any information in any of these to see who didn't agree or who had a different experience. And it isn't really pulled together, like, you know, like you were saying and Natasha was saying, it isn't really pulled together into a clear statement of, this is what we found, you know, this context, this context, this context. It was more, there's clear evidence of distributed health literacy, but again, it's not defined. So it makes it really hard to actually know what the end conclusion is.
Yeah. That has just reminded me of a point that Kath and I were discussing about. There's a quote. It's on page E35. It's actually next to the table that I was talking about. And they've put, again, would love to hear from people with experience in qualitative research, where they've put multiple quotes together. So they've put TIE, GFG, quotes from multiple participants edited together for clarity. And they put this, what I didn't like was that statement was at the end as well. So you've read it, you've probably taken it in, and then they go, oh, actually, we've just made that up because we've merged some things together. And I was like, oh, I don't like that. And Kath and I were talking about how blending quotes together can be used, but it's normally really explicit first that you are doing that, or we were talking about using it for vignettes and things, like it could be used for a purpose, but it's kind of like it's a made up statement using multiple quotes or multiple situations. So I didn't like that they had put it in there and that the little bit came at the end in a bracket. I wanted it to be up front if you were going to be merging these quotes together. But again, I don't know.
Paper? Is that in this paper?
Yeah, page E35.
Yeah, I missed that. So thank you for pointing that out. I wonder if it was something to do with the focus group, which might be a bit chaotic with all the languages going on and the translation and people talking over each other. I bet they should have said that in the methods about the transcription was hard or the transcription was complicated or something. Yeah, that's
it's a big chunk as well. It's 1, 2, 3, 4, 5, 6, 7, 8 lines.
Yeah.
And then they've said, oh, actually, this is quotes from multiple people.
Yeah.
So yeah, I didn't think that was great either. Though actually, what was that? Which section was it relating to?
Actually, when we do the qualitative researches, if there is very important points, 3, maybe 1, 2, 3, we keep in quote that most of the participants said this. Most of the participants responded like this one. And especially when we publish it in the scientific journals, we don't want to quote more than 3 important quotes. But I have an exception because I am working for a public health bulletin now. In the bulletins, we keep the quotations as much as demanded. Maybe one said that I like to take salt. Another said I want to take the salt after frying. And somebody said it's very good if you take the salt after frying because it loses all the water and that will not cause you obesity, this type of thing. We put in the bulletin. The bulletin is for the mass people and mostly for the health professionals who are not doctors. Maybe they are paramedics or the paraclinicians. They find it very useful because then they can relate whatever they listen from their patients in their day-to-day life. So in bulletin type of thing or storytelling type of thing, we keep this much quotations. But in scientific journal or scientific paper, we strictly avoid this more than 3 quotations usually. 1 or 2 or at best 3 is good enough. So here is so many quotations and the inverted things that Thai MU5 FG. I'm not clear about it. What they have said. Maybe the others can help me to understand this.
Sorry, you mentioned 3 codes. Is it 3 codes per code, you mean, or for the whole paper?
For the whole paper. For the whole paper.
Because we're currently working on the lived experience of university students after the explosion that occurred in Beirut in August 4th. And I feel that just sticking to 3 codes would just remove everything from so I was wondering if the others do the same, or does it depend on the topic and
yes, of course, it will depend on the topic. Definitely, it will depend on the topic. If you are working on a very current or burning issue, then the rule is, of course, flexible. But when you are working on a very old type of thing, that like this one, it's a maternal health literacy. It's not a current or burning issue. So most of the participants will have same type of idea, same type of concept in this, and especially from the same tribal or the same ethnic group. So there should not be more quotations in your paper. But of course, you are right. When the topic is different, it's current or burning or something very unusual, then we have to keep the quotations.
Yeah, I think, Carmel, as well, exactly what you're saying about you're wanting to hear the participants' experience since that. I think you need those quotes to justify those findings. Yeah, definitely. So that moves us on to the final question, which is, I actually didn't answer this because I was thinking my views might change when I've spoken to everyone else. How valuable is the research? What contribution is it making? Do they identify new areas of research? And have they discussed if the findings can be transferred and generalized to other populations? I don't know. I don't know what I think, to be honest. It is valuable. I think it is valuable, but there's a lot of questions that we've brought to it and a lot of challenges and a lot of ways that it could be strengthened, I guess, is my initial feelings on it.
Yeah, sure. It's of course it's valuable, but it's not applicable for the whole country or leave alone the other countries,
No.
because yeah, uh, the results are almost similar like in my country also, because here the women cannot independently take any decision. They have to depend on their family members, and always the family or older or elder family members are experienced, and they put their decisions upon the pregnant lady. So it's we cannot say it's that much valuable for all the scientists or all the
No.
person, but in case of Vietnam or a specific area or for the specific ethnic group, it's of course it's valuable, I think.
I think Ronnie's point was really interesting about the definition about distributed health literacy, because the paper is talking about distributed health literacy, but actually what does it mean in that setting? And without that definition, I think that does kind of limit how valuable it is. But I don't know, I guess it depends who is going to use it. And like you were saying, Ronnie, if they haven't got any other resources that they need to go to somebody else within the family to understand it, then I guess that's the kind of element that needs to be worked on. How do we make sure that these messages are understood by our community without the need of going to others? Maybe.
Yeah, I found like it didn't really do the so what for me.
Yeah.
Okay, you confirmed Edward's great, but
yes,
there was no go of pushing further beyond that. Or and some of it seemed like it would be interesting for like understanding how people use information in that context, or perhaps could be useful for immigrants as well if there's big Vietnamese communities or Thai or Hmong in other countries. But that they didn't pull that out either. So yeah, I guess there are a few gaps for me.
Yeah. What Alison, would you say, so the question is I don't know how you answer that, how valuable is the research? That's hard.
It is. I mean, it's good. I guess it confirms or it adds further strength to the Edwards article, which I haven't read.
No.
But for me, I wouldn't know. I probably wouldn't. I'd be like, okay, I'd probably still go back to the Edwards rather than rely on this article.
Yeah.
Anyway.
Yeah,
so
that's true.
From a research perspective, maybe it's not super valuable unless you're really interested in Vietnamese healthcare.
Yeah. Brilliant. But Bonnie, did you have any final thoughts on that?
I thought a similar thing to Natasha, to be honest. Like, I was thinking as I read it, if this was just a report put out by that particular province, I'd be going, oh my God, this is amazing. What useful information for that area. But because it's a scientific journal, that they've been, pretty well tempered in their claims, but you do kind of question, how useful it is and how generalizable it is.
Yeah. Brilliant.
I would say it can be useful for the, like regional information. It gives you more an idea of what happens in that particular region and how different that would be from, let's say, the Arab region. Because in our context too, decision-making happens with the family members and not on a personal level. So it would be interesting to understand these comparisons, or at least to give an idea of what's happening in that particular region.
Yeah. Okay. Thank you, everybody. That has been brilliant. I hope everyone got something from the discussions. Kath, do we have the second? We don't have the second paper yet, do we? But do we have someone who's happy to lead?
Yes, we have a volunteer for the next one. Let me just check in my spreadsheet who it was, but we don't have a paper yet.
Okay.
We do have for the October session. My computer's been a bit slow.
I think I am the next.
Super.
But unfortunately, I have to fly to India for my treatment on hopefully on 26th of September. So if I get back to Bangladesh or get enough time to prepare, then it would be possible. So I wanted to say at the last of the meeting that would you please excuse me, or give or anyone just come upon on my slot, because actually it is not very, I cannot fix it, or I cannot confirm that I will be there. So it would not be wise if I put the slot on my head and you lost the time. So if someone is ready to volunteer on my slot, that would be very nice, and I will be grateful.
That's absolutely fine, Natasha. We had a volunteer for November, so I could contact that volunteer for November and see if they'd like to.
I think Diane, yes.
Or, you know, if anybody here now would like to jump into the October slot, now is your...
Now it's wide open. You could just pop yourself in. We're a friendly group, as you've all discovered. It's a nice
I'd be happy to be the backup if the November person doesn't want to move, or put me down for November or whatever works.
Super, Bonnie. Thank you.
Okay, Bonnie, thank you so much. I think Dulcie, or sorry if I'm pronouncing wrong, Dulcie said something in the chat box.
Yeah. I think I was going to say, I think they're writing, but it just says dear all at the moment.
Oh, okay.
Yeah. There may be more to come. Oh, thank you so much, everyone. Does anyone have any questions or comments kind of on the structure and using the CASP tool? I personally like having something to guide us through, but I know other people hadn't used anything like that before. So I'd love to hear if people found it okay.
Yeah, I think it's great. It's great, simply great, because it tried to focus or to evaluate the paper, and it will make all the health literacy researchers actually to make a standard paper. Even it's a non-formal group we are practicing, but maybe we can include more, then they will have the good guideline for their future publication. It was very good. Thank you.
Oh, brilliant.
For me, it was also very good because it structured our discussion as well. It was nice to see how we went gradually through the paper.
I think it was great. And I think everyone's able to bring their experiences and their knowledge. So I think it's a great way to come together. Dolce has said that they're on the train, so the Wi-Fi hasn't been great, but they have taken notes and they will be able to access the recording. So that's super. Brilliant.
Can you remind me when the next meeting is? Sorry, I missed the next date. October sometime.
Will it be October sometime? It will depend on the availability of whichever presenter we have. So what I'll do is I'll contact the November volunteer today. If she can't do it, then Bonnie, I will I will contact you for your best available date, and we can go from there.
We said we'd be flexible on the time depending on the time zone of the person who's facilitating, because they might not want to do it at 1 in the morning or something.
Because it's mid-September now, so to give people like time to read the paper, I guess we would be looking at like the second half of October, unless people are really keen. But yeah.
Thank you so much. So nice and kind of you all. Thank you.
Yeah, it's been a lovely start to the day over here. And I will finish my coffee and enjoy. I also just realized that we were still recording and Betsy comes in. So I mean, ever the professional over here.
No, it's a very informal group, but we enjoy, especially me. I like to see her very much. I just loved her.